I'm Joel Stanley. This is public speaking class. This is persuasive speech. Do you know your status? Do you know what it means to know your status? Please allow me a few minutes to explain that question and the context of the phrase, know your status. I've been an HIV advocate for several years, and I chose this topic because recently an individual that I'm close to was diagnosed with HIV, contrary to having knowledge about the virus. Knowing your status means maintaining your health and well-being. The initiative to know your status offers tools, education, to help you make informed decisions about your personal life, sexual life, and to take control of your health and well-being. By knowing our status, we know if we're living with human immunodeficiency virus, also known as HIV. HIV is transmitted through 4 modes: breast milk, blood, vaginal secretions, and semen. HIV is also transmitted from mother to child during childbirth. It's through a blood process, but healthcare professionals take extra precautions to make sure that this does not occur. The CDC estimates that 1.2 million Americans are living with HIV. It's also estimated that 35 million individuals across the world are living with HIV. The CDC recommends that for sexually active people who participate in sexual activities with individuals that are not in a monogamous relationship get tested every 3 months. Active IV drug users should also get tested every 3 months for HIV. To keep ourselves safe, we can use personal protective equipment like male condoms, female condoms, and dental dams. These are used for oral sex. You're also able to practice sexual activities without the exchange of bodily fluids. And for those individuals who use IV drugs for recreational activities, they suggest you use your own needle. You can repeat your needle use if you have to, but never share with another individual. Some states have needle exchange programs, so check with your local agencies to see if that's available to you. For individuals who come into contact with bodily fluid that may have blood, it's also important that you use protective equipment for yourself, like gloves. If you risk not using gloves, you also should get tested every 3 months. It's important to know your status. An individual can get tested different ways. There's anonymous testing and confidential testing. Those who get tested anonymously will receive a code that is an identifier that's only for one person to receive the information of the test. A confidential test means that your information is kept in your record for as long as you live. It'll follow you in your medical records. The most common HIV test is a blood finger prick. This tests for the antigens in the blood. This takes about 2 to 3 drops of blood. You can get the results in about 20 minutes. The HIV antibodies, from the time of contraction, the time of contraction of HIV, it takes between 2 and 12 days for the body to begin creating the antibodies that the test will detect the HIV virus, or the antibodies for the HIV virus. This blood test will not pick up results for about 4 weeks. And after 4 weeks, it's only about 95% accurate. There are many resources in the community in your area to get tested. Some of those include the Charles Drew Health Center, Nebraska AIDS Project, Youth AIDS Coalition, Council Bluffs Department of Health, Douglas County Department of Health, and your family physician can also give you the test. If you test positive, like I said, there are many resources in the community. This opportunity to speak to you about knowing your status and getting tested comes at a good time. World AIDS Day is December 1st. There's an activity at the Community Engagement Center on UNO's campus from 5 to 6:30. Community partners come together for a common goal: get to 0. That means no new infections, no AIDS-related deaths, and we're going to erase the stigma and discrimination associated with HIV. A great resource is www.aids.gov. This resource will help others who are living with HIV, help teach safer practices, helps with the medication regimen. This also provides other valuable information for family members and friends of those living with HIV and anybody affected by the virus. The best information that I can share with you is that your sex, your gender, your sexual orientation, gender identity, race, religion, age is not going to protect you from contracting or transmitting HIV. Only you can do that. So I know my status. Do you know yours?